Welcome to everyone. Thank you for the invitation to the BGI and especially to Xivan. It's a great pleasure to be here in Riga. It's such a beautiful city. We visited yesterday evening. And I would like to introduce the non-invasive prenatal testing experiences in Hungary. We are working in a private clinic, and our main profile is prenatal investigations. So, the prenatal health service in Hungary taking two parts. There are publicly funded investigations. Public hospitals are doing only these investigations. There are 4 ultrasounds during the pregnancy at gestation week 6, 12, 18th and 30th. And chromosomal investigations from chorionic villi and amniotic fluid only above the maternal age of 37. Our clinic do these investigations and other self-funded investigations like combined tests and non-invasive prenatal testing. Combined test means when we do an ultrasound at gestation week 12 and taking a blood and analyze 2 blood markers. One of them is beta HCG and the other one is PAP-A. And we do a risk evaluation for the most common chromosomal abnormalities like Down syndrome, Edwards syndrome, and Patau syndromes. And our other main profile is non-invasive prenatal testing. Is based on the fetal DNA, fetal cell-free DNA circulating on maternal blood. There are 10 million people in Hungary, and the number of babies which are born is 90,000, 95,000. And in last year, in Hungary, there were 12,000 NIPT tests, which is the 13% of the population. And because it's self-funded, not anyone can pay for it. That's why this low percent. As you can see, the increasing of the NIPT tests in Hungary, we started in 2014-15, and for 2021, it was 12,000 over Hungary. In our clinic, we do two NIPTs. One of them is NIPT, and the other one is trisomy from Medirex. You can see the number of our NIPTs in the clinic. Last year was nearly 1,000 from trisomy tests and more than 5,000 from NIPT tests, which means that it's nearly 6,000 tests last year, and it's covered the 50% of the Hungarian market. It's, I think, quite high number. So, National Health Professional Directive for Non-Invasive Prenatal Testing was born in 2021, and it contains the principles how to make the NIPT tests in Hungary. The first very important principle that NIPT is offered only after first trimester ultrasound. It's very important because if we detect severe chromosomal abnormalities at the ultrasound, NIPTs are getting contraindicated, and only prenatal chromosomal investigations are recommended. NIPTs can detect the most common chromosomal abnormalities like Down, Edwards, and Patau syndromes, which means trisomy 21, 18, and 13, with more than 99.9% negative predictive value, and can detect some other numerical chromosomal abnormalities like chromosome 9, 16, and 22, and the sex chromosomal alterations as well. But we can know that most of these positive cases from these chromosomal abnormalities has to be the consequence of a placental mosaicism, which means that sometimes there is a differentiation between the placenta and the fetus. There is another genetic material in the placenta, and because the cell-free DNA originates from the placenta, it sometimes reduces the PPV in these cases. And that's why amniocentesis is always recommended to confirm positive NIPT results, because of the placental mosaicism and because it can be from the maternal DNA, the positive result. Some NIPTs can detect several microdeletion and microduplication syndromes as well. And another principle, that after unsuccessful NIPT, amniocentesis is offered because the chance of aneuploidies is increasing of these cases. So in conclusion, NIPT is always considered only a screening test and never will be a diagnostic tool because of the mentioned causes. Why can we offer NIPT test? Because it detects 94 different chromosomal alterations and knows 84 microdeletion and microduplication syndromes. It's validated very high number of cases in the world and had more than 900 million NIPT tests over the world. And we had in our clinics in the last 9 years 21,000 tests. So NIPT is the world's leading non-invasive prenatal test, and based on whole genome sequencing with very, very high detection rate. I can tell you that NIPT is not only a test, it's a very high quality NIPT service in our clinic and in Hungary. We are working with several partners, nearly 200 partners all over Hungary. And we do a NIPT test. Is the first step is a pre-test consultation, mostly with clinical geneticists. The doctor tells the information about the NIPT, tells the advantages and the disadvantages about the test. And the next step is a blood drawing, then filling the requisition form and sample administration. And our laboratory is doing the plasma separation. Then we send the plasmas to the BGI, to Hong Kong. Then when we get back the report, we do the validation. And the next very, very important step is a post-test consultation when we inform the gravida about the result. If the result is negative, everything will be okay. But if the result is positive, we have to recommend fetal chromosomal investigations, which is mostly amniocentesis from amniotic fluid. Then, when we get the result from amniocentesis, we inform the patient about the chromosomal result, and the couple has the chance to decide about the outcome of the pregnancy. Very important to educate our patients. We have been doing this for 9 years and do it through the internet mostly and through the media and the magazines as well. Okay, the statistics. We did more than 18,000 NIPT tests, and only 0.3% was inconclusive, and from the conclusive results, only 1.9% was positive. Was positive for Down-Edwards or Patau syndromes, it was 60%. For sex chromosomal aneuploidies, it was 16%. Other numerical chromosomal trisomies was 3.5%, and microdeletion and microduplication syndromes was nearly 2%. And we had a lot of incidental findings, nearly 18%. In this diagram, you can see all of the positive cases. After the confirmation investigations, you can see the PPV and MPV values. In most of the cases, positive predictive value is really high, except for Turner syndrome and other trisomies. And the cause of the maternal aneuploidy can be because if we get a positive Turner result, mother has Turner syndrome or mosaic Turner syndrome, and this reduces the PPV value. And the other thing that, according to the other trisomies, in 90% of the cases, the cause is the placental mosaicism. So only the placenta produce the genetic abnormality, not the baby. That's why it's very important to do the genetic investigation from amniotic fluid. MPV values, negative predictive values, are nearly 100%. And according to sensitivity, I show the duplication and deletion syndromes. It's only, unfortunately, 60% because we had 2 false negative cases during this period. There was Prader-Willi syndrome and Williams syndromes. And the specificity is really high, nearly 100%. I would like to show you some case reports. The first case was a 28-year-old gravida with first spontaneous pregnancy. The combined test showed low-risk result, so there was no indication to make the NIPT test, but the couple insisted on to do it. The NIPT result showed Down syndromes, and the BGI informed us that duplication can be at the background of this positive result. So we did the fetal chromosomal investigations. From amniotic fluid, it was a normal karyotyping and an RACGH. Both of the investigation was negative, but we found duplication at the mother, which means that the NIPT result was positive because of this duplication. The second case was a 39-year-old gravida with her first spontaneous pregnancy. The combined test showed an intermediate risk for Down syndrome. The ultrasound was okay, the nuchal fold was normal, and the nasal bone was visible. And we found duplication on the Q arm of the chromosome 16, quite large 60 megabase length duplication, and it was very important to do the RACGH investigation, which was found this duplication that the NIPT had found earlier. And very interesting thing that at paternal karyotype, because of course we did the couple's chromosomal investigation, we found that was a fragile site on chromosome 16 at the father, and this was the cause of the duplication. And it was a very pathogenic variant, so with a lot of dysmorphic features and severe intellectual disability, central nervous system abnormalities. So the pregnancy was terminated, and we offered prenatal genetic investigations to the couple, and so it can be done at our clinic because we are dealing with PGT as well, structural and monogenetic PGT. The third case was a 26-year-old gravida with her second spontaneous pregnancy, and she had one miscarriage before, and in her pregnancy, we found high-risk result at combined test for Down syndrome. The ultrasound was very, very severe with hydrops fatalis and with 6.1 millimeter nuchal fold and hypoplastic nasal bone. But we offered them amniocentesis, but the couple insisted on NIPT test, and the NIPT test found duplication on the Q arm of chromosome 3, but due to the severe abnormalities, the pregnancy was terminated, but we did the karyotyping of the couple and found a very, very interesting alteration. It was an insertion between chromosome 3 and 21, which meant that this duplication that was previously found by NIPT was inserted into chromosome 21, and that means that the couple has to make a PGT, and we offered them PGT, and unfortunately, the first PGT was unsuccessful, but the couple tried again in the future. There are 2 cases with positive NIPT for Down syndrome, where we did first the CVS, and the direct CVS, which is from cytotrophoblast, which is only the placenta, showed normal karyotype. But when we did the amniocentesis or the cultured CVS, showed the Down syndromes. And it's very important and show the high sensitivity of the NIPT test because both of these cases had placenta mosaicism. So it means that NIPT test can detect the Down syndrome when the placenta produces normal cell lines, but it can see the fetus as well. In the second case, it was 50%, so a mosaic case, 50% normal and 50% Down syndrome. So in conclusion, in our institute, we do NIPT and trisomy tests. So NIPTs are very, very reliable prenatal tests with very high sensitivity and especially high specificity. And when we offer them if the maternal age is above 35, or there is intermediate risk of the combined test, or there is high risk of the combined test, but the risk is less than 1 in 100. Or if there were chromosomal abnormalities in a previous pregnancy. And the other case, if the gravida is afraid of the invasive prenatal investigation because of the risk of miscarriage. Thank you very much for your attention.
Please, questions? I think I heard myself.
Thanks, Anna, for this nice presentation. My question goes to the follow-up of the patients or the pregnant mothers or pregnant women who are positive for NIPT, but maybe negative in the CVS or amniocentesis, because 50% of them seem to have leukemia or so, and we have, I think, there a gap of clinical care in these patients. At least in Germany, most of these women go immediately to abortion without confirming it with CVS technology. I guess it will be the same tendency in Hungary as well. But I think these information could be really useful for clinical management afterwards in case of testing for leukemia of these young women.
We try to follow up these cases, of course, and 80% of these positive cases we are doing at our clinics, and sometimes 5–10% of these cases are done in any other clinics, but we always contact with the doctors there, then try to follow up these patients' destiny, and usually we know about the abortions, and if the cases are negative, we always ask a follow-up from the patient. Sometimes they email us, sometimes not, but we try it. We have a big Excel table for this. It's very important, I know.
Okay. Other questions? I have a very simple practical question. How long does it take to get an answer back from the BGI?
Okay. Sorry?
How long does it take to get answer for this
the test time,
Yeah.
it's only 5–7 days.
Okay.
It's very short time, I think.
Yeah, yeah, because timing is really, really important here. And I guess if someone would like to do this service in their own laboratory, I guess it would be much more difficult to ensure that short time of the response.
Yes.
Yeah, sure.